Hello, Dr. Hill here, back with another YouTube video for you guys. Today we're actually gonna get into a little bit of pediatric dentistry or dentistry dealing with kids. I get questions all the time, new parents, even grandparents, kids ask me all this stuff, all sorts of questions about going to the dentist. What do we do? What do we do at home? All that kind of stuff. So I'm gonna kind of go over a couple questions that I've been getting quite a bit lately, especially with kids being out of school. We're seeing more kids now and all the COVID stuff and everything. So we're going to dive into a little bit of those questions and kind of go from there. First one, when should kids go to the dentist? Great question. Get it all the time. The biggest answer for this, according to the ADA and the Pediatric Dentistry, what they say is by the age of 1 or within 6 months of your first tooth, or the baby's first tooth or kid's first tooth. Now, most parents tell me I'm crazy when I tell them that, but that is the standard, that is the rule of thumb that we go by, that is the recommendation from the highest board that we can go off of. Does the first visit always go well? No. Do we end up with a lot of tears? Yes. We are used to that. That is what we do. It's okay. I will tell you, the first thing in the first appointment, I always tell parents, the big thing that we're trying to do is get them acquainted to being in the dental office, okay? You gotta remember, you're coming to a scary place with lots of loud noises, lots of things going on. So the biggest thing we're trying to do is we just wanna get the kid in the chair. We wanna try to see if we can brush their teeth. We wanna try to see if we can even look inside their mouth. Most of the times, it does not go well. That is okay. As we continue to come in, they continue to get more comfortable in the dental office, in the chair, hearing those noises. It's not a scary place, all that kind of stuff. That's when we can do more. That's when we can look in the teeth. That's when we can take potential x-rays and photos and all this kind of stuff. So for me, the rule of thumb, by age 1 or within 6 months of getting their first tooth. Like I said, most parents think I'm crazy when I'm telling them that. Just try to bring them in. The reason why, if you continue to wait, I see a lot of kids that have never been to the dental office in 4 or 5, they reach the age of 6 and they've never been in. That is always too late, okay? Because by that time, we're introducing a crazy element to them. Potentially they already have some things going on. We weren't able to educate the parents on how to take care of their kids. Things could be going south. There could be a lot of things going on. So to me, the earlier the better. Age 1 or 6 months, all right, within their first tooth. All right, next question. Is fluoride safe for kids? I get this question a lot. I hear all this stuff about fluoride and it's good for the kids' teeth and it's good for my teeth and you put it on me at the end of appointments and all that kind of stuff. But what about, infants and babies and kids that can't really take care of themselves and do all that stuff? Fluoride is good for anybody and everybody's teeth, no matter the age. 100 years old, 1 month old, all the same, okay? Now, I will tell you, there's some caveats to that. With kids, one of the main ways that we get fluoride, and actually I guess it's with adults as well, but especially with kids, is tap water. A long time ago, they ended up placing and adding fluoride into the water after we learned all these things about how good and how well it is for teeth. Again, as we're aging, especially as kids, when we're growing those teeth, those permanent teeth are starting to growing, all that, that's when fluoride is the most key. I will tell you, when you are talking about fluoride toothpaste, it is super important that you are aware of how much fluoride toothpaste you use for your kids. I have been told by parents they end up using the same amount of fluoride toothpaste for their 6-month-old or 1-year-old as they do for themselves. That is a no-no. When you are giving toothpaste or fluoride toothpaste to kids, you got to remember they cannot spit. So at the age under, I would say it's about 3, those kids are not able to spit. The big thing with fluoride is you don't want them to ingest too much fluoride. So what I tell parents at that time, okay, when they are younger and even under, I would say 5 to 6, if you are going to use fluoride toothpaste, give them a rice size amount on those children's toothbrushes, the soft bristles, all that. I'm talking small as they age, 3, 4, 5, 6, and they are able to spit, they're able to get rid of everything. Then you can kind of go up to a pea size on the toothbrush. The big thing for this that I always tell parents is I want you in the room with them while they're brushing their teeth. Always. You need to be the one that comes in after, gets rid of the little sugar bugs and makes sure everything's clean and does all that kind of stuff. That is super key because obviously kids are going to do whatever they want if they don't know better. So parents being in there and helping, that's awesome. You can make it a family time event. You can brush your teeth while they're brushing their teeth, get them kind of involved with it. It's a big key to being healthy and to making sure that we can avoid problems so that they don't have to come in to see us, because obviously parents don't like coming to see us, so why would kids? Let's get right into the other one. I get it all the time. Should I give my kid or send my kid to a pediatric dentist, or is it okay to come see you? I am a general dentist. It is okay to see a general dentist with your kids, okay? I love working on kids. I think they're fantastic patients. I think they're awesome. They make my days better when I see them. They're fun. They're outgoing. They just say whatever they feel, which is awesome because I wish I could do that these days. But I will tell you, the big caveat for that, you have to feel comfortable with where you take your kid, okay? I have a lot of parents that just don't feel comfortable having their kids come see me because of all the other adult stuff I do. And that's fine. It's whatever is most comfortable for the parent. I love bringing kids into the office and to seeing them. My hygiene staff loves them because they're actually a little bit of a break in the day. You gotta love somebody that says whatever they want and kind of does whatever they want, and kids always do that. So for me, I always say, if you want to and you feel comfortable with your general dentist, go ahead and take your kid to that general dentist as well. If the general dentist doesn't feel comfortable with them, that's fine. They will give you pediatric dentists that they trust and that they respect. That's how I would do it. Now, most general dentists don't really work on kids if we have cavities and if there's bigger cases and if there's problems going on. Fine. I would then ask your general dentist, can I get some referrals to a pediatric dentist that will end up being able to help, being able to take care of your kids, doing all that kind of stuff. Regular cleanings, maintenances, things like that, coming in for fluoride, all that. To me, a general dentist is a great way to go, as long as you feel comfortable with that general dentist seeing your child. Another one, loose teeth. I get it all the time. Tooth fairy's coming soon. What do I do? Okay. Do I bring my kid in to see you to pull those loose teeth? Do I stay at home? Do I give him, a Twinkie to eat off of? Do I give him a piece of bread to chew it out? What do I do? My rule of thumb is, if you or your kid can pull the tooth out themselves, do it. Now, that's a big asterisk in the fact of, if the kid has any issues, it hurts, you see some swelling, you see some redness in their tissues, they're not eating because of it, or they have a fever because of it, anything like that, that's when you get them into the dentist to help assist in that. But no problems, the tooth is wiggling on its own, you're doing a decent job, things are moving for you, go ahead and let the kid do the thing, take it out. They actually kind of get some relief from it. They feel like they're accomplishing something like that, and they get the tooth fairy to visit, which obviously, who doesn't want the tooth fairy to visit? I think that's a great thing to do. But pain, swellings, not eating, not feeling well, things of that nature, give the dentist a call. The dentist will always help you and assist you on that. That is, the most of the pediatric big questions I get. So hopefully you could learn a little bit of that. Send some more questions in, send some more comments in. I'd love to help you out, love to talk more about this. Go ahead, like, subscribe. We'll see you soon.